recent survey conducted by a leading health magazine reports that 60% of people suffering from vaginal yeast infection are not able to diagnose the infection in its early days. This statistic is enough to tell you that early diagnosis of vaginal yeast infections is important for the effective treatment of the disorder. You'll be surprised when you hear that the symptoms of a vaginal yeast infection are simple to find, yet are very difficult to correlate to this disorder. For example, if you're suffering from this infection, you could find a white discharge flowing over the walls of your vagina. Deeper research is required for a doctor to conclusively prove that you are indeed afflicted with this infection. To achieve this, the doctor would scrape a specimen of the white discharge from the affected area and put it under the microscope. A rigorous and expensive analysis is carried out on the specimen to find out if any possibility of yeast infection exists. This is possibly the easiest and the fastest way to identify if a person is suffering from a yeast infection. Any method other than this can only suggest the possibility, but may not be good enough to prove conclusively that the person is suffering from this disorder. Bottom line, if you're experiencing a white discharge from the walls of your vagina, it's time for you to rush to your doctor. This is probably the only way you can confirm if you are infected with vaginal yeast infection.